What we're looking at here is a 60B elevator. Now, this is something that I picked up while I was perusing Instagram, and I have to admit I don't go on Instagram much. And if you guys aren't on Instagram, maybe consider it, because truthfully, dentistry is pretty prevalent on there. You see lots of great cases from all different disciplines, not just surgical stuff and extractions, but prosthetics, implants, you name it. So it's worth checking out, and there's no shame getting into the social media world if you want to do that. This guy here I picked up from watching an oral surgeon on there, and I was trying to figure out what kind of instrument he was using. Finally one day I sorted it out, and it's a great tool. Now, I've used the 63 elevator, and we talked about it earlier on in the course. It is a spade-shaped elevator as well, but it's a straight shank. Now, this one here, you'll notice, has a bit of an offset to it. Now, the offset is nice to help you to get back into the posterior part of the mouth. Also, what is nice about this is that they have a sharp tip on them. Now, I've used this one quite a bit to the point where I've kind of blunted it off, but when you buy a brand new one, you're going to find that they do have a pointier edge to them, and they still work good just in this condition as well, but they'll work even better when they're straight out of the package. Now, what I like about this and the situations that I tend to use it would be for upper impacted third molars. So it's terrific for that. And there's a few reasons. One, like I said, is the sharp tips that allows you to push apically, kind of wiggling and wedging the tooth. And that keeps you from, I guess, pushing too much distally on the tooth, right? So we always want to be delivering that tooth down coronally and out to the buccal, right? We never want to be pushing distally or apically on those third molars. So this little offset here helps you to get back into the purchase point between that second and third molar, and it allows you to push and get deeper. So that's great. The other thing that I like up in that region is that this tip here is quite broad. Now, this is something that we don't often think about, but when you're up there elevating on those third molars, you are elevating sometimes against that distal buccal root of the second molar. So what you have to know is that you're going to be concentrating a lot of stress onto that distal buccal root. And if you have a broader tip like you do here on this elevator, you're actually going to be displacing that pressure a lot more than you would be if you had a thinner elevator. So overall, I mean, it's going to be a little bit kinder and gentler to that second molar. The other thing that's kind of nice is it's got that spadey kind of shape, right? So you think of a spade shovel, how it kind of curves around, right? So it's got the curve shape to it. Once you get in sort of past that third molar, it almost allows you to kind of cradle the molar and keep it, get up onto that almost lingual side of it, right? So it helps you to control the tooth a little bit more, I find, and help to bring it more down into the buccal, which is where we want to direct things. So again, this is a terrific instrument. This one comes from Titan, I believe, is who sells it. And I haven't found them in too many other locations, but that is a company that will carry them. The 60B elevator, give it a shot, you're going to love it.